Would you say then, like Buddhist monks, for example, they will meditate and get in kind of that sort of like a trance state? I'm not sure if that's correct. Is that similar then to the type of, I don't know how to word it correctly. Is that similar to hypnosis in the sense that you're experiencing kind of a different state of mind and relaxation?
It's similar.
Okay.
You're exactly right. Hypnosis, actually, what hypnosis is just utilizing trance states to accomplish certain goals.
Okay. Being that you're more susceptible during those times if you're relaxed?
With trance states, you can access the subconscious mind more directly. Mm-hmm. And the subconscious mind really is part of the mind that experiences almost everything. The conscious mind is really a very, very tiny sliver of our experience. Mm-hmm. We only have the ability to be consciously aware of
so much.
Really, I think it's been determined, 128 bits of information per second, whereas the subconscious mind can process millions of bits of information per second. You're just not necessarily aware of it. Mm-hmm. And so pretty much all experiences and all learning and all emotions are actually in the subconscious mind. Okay. The conscious mind acts as a kind of filter to direct our attention. And during hypnosis, what we do basically is get the subconscious mind, get the conscious mind out of the way. We give it something else to do so that the subconscious mind is accessible to the client and they can work directly on it. And that's why hypnosis can be so useful for dealing with things like long-standing anxieties or phobias. Pain is another good example. Any kind of learned behavior can be accessed directly and changed in the subconscious mind through hypnosis.
Okay. What would you say that you work with patients most often with hypnosis for? Any certain condition that's more prevalent than others, or?
Well, it's interesting. Even though my main interest is in medical hypnosis, particularly dealing with chronic pain, with chronic disease like cancer, it's very useful for pre- and post-operative treatment in patients with cancer. It helps relieve the symptoms of chemotherapy. It's also very useful for almost any condition that is out of conscious control. For example, anxiety and phobias. Those things are not things you think about, they just happen to you. And so those are really out of your conscious control. I mean, when you experience it, it just feels to you like it just arises from nowhere. But it doesn't arise from nowhere, it arises from the subconscious mind. It's a pattern, it's a learned pattern of response. For whatever reason, at some point, that pattern got ingrained in the brain. And now every time there's a certain stimulus, and you may not even be aware of the stimulus, the same pattern emerges. It's as if you were driving down the same road time after time. You know, there are ruts that develop in the road if it's a dirt road. And so that every time you hit that road, you're likely to fall into that rut. Because it's a pattern that gets reinforced every time it gets expressed. And what we do with hypnosis essentially is move the tires to a different road or outside of the ruts. And what happens over time is we can actually install a behavior pattern or a thought pattern that is more productive and more beneficial to the client. The old ruts are still there, but they don't have as much effect. I'll give you a good example. I had a client who had terrible anxiety, had panic attacks. They were so bad that she'd have a panic attack and actually have to stop her car at the edge of the freeway and get out of the car. She couldn't even stand being in her car. And she had had some very bad panic attacks, a very bad experience on an airplane. The last time she'd been on an airplane, which I think was about 5 years before I saw her, she was nervous getting there to begin with. She got in her seat, they buckled the seatbelt, they pulled away from the gate, and she freaked. She actually made them go back to the gate, open the door, and let her off. That's pretty bad. Very debilitating.
Absolutely.
So I saw her for about 4 sessions. She came to me because she wanted to go to her friend's wedding. Her friend was having a wedding in Cabo.
Mm-hmm.
And she wanted to go to her friend's wedding, but she couldn't figure out how to get there because she couldn't get on a plane.
Mm-hmm.
And so I worked with her. I only had a month before the trip, so I worked with her for 4 sessions.
Okay.
And we worked on changing her perception of the experience. First, the first thing we did is sort of show her how to go into hypnosis, because that's something that you learn. It's not something that you do to somebody. I don't put somebody in hypnosis.
Mm-hmm.
I work with them to show them how to go into a hypnotic trance.
Okay.
So that's the very first thing they learn, is how to go into hypnosis. And then they learn how to use that trance state to develop a feeling of calmness, peacefulness, security.
Mm-hmm.
And once they learn to develop that feeling, we use something called anchoring, which is we associate that feeling with a specific physical gesture.
Okay.
And we do that several times to make it a habit. Every time you have that feeling, you do this gesture. Every time you do this gesture, you have that feeling.
Mm-hmm.
And so she learned how to go from a place of panic to a place of calm and security by making this gesture and by practicing doing that again and again. And then just before the trip, we actually went through every single step of the trip, what it would be. And every step that used to make her nervous, going through security, getting online to get on the plane, buckling the seatbelt, the takeoff, the landing, each step that may have been a trigger to trigger anxiety and panic, I reframed that so she could see that in a way that didn't induce anxiety. In fact, in a way that was designed to make her feel safer and more secure. And so she went on the trip. She said she was a little nervous, but she went on the trip. She had a good time.
Mm-hmm.
Since then, she's flown a number of times.
That's amazing.
She's moved to a new city, started a new job, and her number of panic attacks is pretty much, they're almost gone, basically.
That's so amazing.
She's just so much better, having learned how to, change her own state of mind.
Interesting.
And
So
so
it really is
what
a
this
learning.
does really is it really empowers people to use their own internal resources
Okay.
to overcome some of their limitations.
Okay. Makes so much sense. That's awesome. That's amazing that she's doing so much better now. Absolutely.
It seems amazing,
Yeah.
but when you do hypnosis, you see this again and again.
Yeah.
That the power of the human mind, both to create, maladaptive states like anxiety,
Mm-hmm.
the mind also has the ability to heal
Mm-hmm.
and to create positive states.
Yeah.
And each of us has that within us. And all hypnosis does is really kind of unlock that potential and teach people how to utilize their potential to accomplish what they want to accomplish.